Picture this, you're on your way to work or school and get into an accident. You're losing a lot of blood, but the ambulance gets there in time and takes you to the hospital. You're at the hospital and it's chaos. Doctors are running around trying to save your life. A doctor gestures to a nurse. Quickly, get the milk. Hi, you're welcome to my YouTube channel. If you're new here, my name is Toke. I'm a third year medical student, and in this video, we're going to be talking about one of the most bizarre parts of medical history. If you're a returning viewer, thank you so much for being here. As you can probably already tell, this is going to be a bit different from my usual content, but I hope you enjoy it anyway. And I'll still have, school dogs, study content, so please stick around. And now let's get into the video. Start with a brief history of blood transfusion. So the first successful blood transfusion was performed by a physician named Robert Lower in the 17th century, and he developed a technique that enabled him to transfer blood without excess coagulation. And guys, this is about to get graphic, so he demonstrated this when he bled a dog and transferred blood from a larger dog to that dog using a quill made of goose feathers. This was successful, I guess, because the smaller dog survived and the larger dog did not. After this, Robert Lower tried transferring blood from a lamb to a man with mental illness. So he was hoping that the lamb's temperament would cure the man's mental illness, I guess. So obviously, this didn't work. He successfully transferred the blood from the lamb to the man, and the man survived, the lamb did not. But the man's mental illness persisted. Robert Lower basically paved the way for blood transfusion. And after that, in 1667, another doctor named Jean-Baptiste Denis transfused the blood of a sheep into a 15-year-old boy and a laborer. And the 15-year-old needed blood because he had undergone about 20 blood lessons as a treatment for fever. This is something we're going to be discussing in another video, the practice of blood lessons. So please stick around for that. So these transfusions were likely successful because they involved small amounts of blood, and they weren't always successful. After these first two transfusions that John Baptist successfully carried out, he ended up being responsible for the death of a Swedish baron named Gustav Blond and a man named Antoine Baroy. I hope I'm pronouncing their names correctly. So these transfusions weren't always successful, and as you probably noticed, most of these transfusions were done from an animal to a human, and the reason for this was because most times the donor would not survive the transfusion. So ultimately, in 1670, these experiments were condemned by the French government, the Vatican, and the Royal Society. So all research into blood transfusion were on hold for a very long time, about 150 years. In the 19th century, doctors thought of a way to circumvent all the issues associated with blood transfusion. And what solution did they come up with? Milk transfusion. Yes, you heard that right. Milk transfusion. The first milk transfusion happened in Toronto, Canada in 1854 during a cholera epidemic. So the two main doctors involved were Dr. James Boval and Dr. Edwin Oder. They believed that the oil and fat in milk will eventually become white blood cells in the body. The first patient was a 40-year-old man who was injected with 120 ounces of milk. That's about 30 mils of milk. And this man seemed fine, like he seemed to respond well. However, the next 5 patients they tried this with died. But despite these poor outcomes, milk transfusions were a very popular treatment in North America especially, and particularly in the treatment of tuberculosis. And part of the reason why these milk transfusions were still popular, even with the poor outcome, was because of the fact that nobody could really agree on what these outcomes were. Like, you see some people saying, oh, this is like the best thing, like it really works, and some people would die from it, basically. After receiving these transfusions, patients typically complained of chest pain, headaches, and nystagmus. Nystagmus is the rapid repetitive movement of the eyes, and most of these patients died. So by 1890, new transfusions had become unpopular, and they were replaced by saline infusion. And saline basically serves as a volume expander, meaning like just increases the volume of blood in the body. Before we move on with this video, I just want to say if you've enjoyed the video this far, Please leave a like, leave a comment, and subscribe to my channel. It helps a lot. Definitely you enjoy this content. Helps you to know you enjoy my content. So please leave a like, leave a comment, and subscribe to my channel. Thank you so much. Finally, in 1901, a safe and effective way to transfer blood was established after the discovery of the three blood groups by Karl Landsteiner, that's the ABO blood grouping system. So I guess we have Karl Landsteiner to thank for the fact that we can get blood transfusions now and not milk. Today, common alternatives to blood transfusion are things like volume expanders like saline and then oxygen therapeutics, which replace the oxygen that will normally be carried by hemoglobin in red blood cells. So thank you so much for watching this video. I hope you enjoyed it. Was this your first time of hearing about real transfusion? What do you think about it? Please leave all of that in the comment section. Leave a like and subscribe to my channel. And I'll see you next week. Yes, I'm going to be posting videos like this on the most bizarre parts of medical history every week. So subscribe for that. Thank you for watching again and bye.